Well, I've always been quite interested in the pharmacology of NSAIDs and of ACE inhibitors. Since when I went into general practice in the 80s, it was a golden age of new NSAIDs being launched every year or so and new ACE inhibitors, and I followed it fairly closely at the time. So how does this relate to COVID? Well, it didn't initially. It was a year ago that my friend Glenn phoned me up to describe the appalling cough that he had suffered for many months, and how traumatic this was and how difficult it was to get it treated, and described how he had discovered that the cough was due to ACE inhibitor, and that if he took aspirin, it stopped it dramatically, quite quickly. Well, it was established fairly early on in COVID that it hits the ACE2 receptor. Now, the ACE2 receptor is not exactly the same as the ACE receptor, which ACE inhibitors inhibit, but they are related, and they both operate in the same part of the inflammatory system.